All right, the numbers are staggering. More people die from opioid-related overdoses than car accidents or gun violence in America. That's according to the CDC. In fact, an average of 130 people in America die every day from opioid overdoses. Those painkillers, yes, they're strong and they can be effective, but they can be addictive. We've seen an increase in both heroin use and the use of synthetic opioids over the last decades, but doctors are finding alternative ways to ease pain in their patients. This morning, we're joined by Dr. Ken Peters, a urologist at Beaumont Hospital, as well as Dr. Michael Sikorsky, an anesthesiologist with Beaumont. Thank you guys so much for joining us. So we hear about the opioid epidemic, but before the epidemic, I mean, opioids they're powerful, but they are effective painkillers.
They are. Opiates are effective for treating pain, but they have never been intended to be used for chronic long-term pain. However, we have not had very effective options in the past.
So yeah, they were sort of misused. They're very effective. Doctors know that, anesthesiologists know that, but they were designed to be used for short term. But people have been using them long term because we haven't had effective options for long term pain?
Correct.
All right, so what are some of the developments and evolutions that you guys have now to manage long-term pain?
Yeah, so, we've been looking at management of pain for a very, very long time. And one of the things that we do a lot of is really a multidisciplinary approach, working with our colleagues, both in, anesthesia pain, for us, urology, pelvic pain, but working with our physical therapists, our integrative medicine, to really kind of look at all the pain triggers that could potentially cause pain and then try to address those triggers. The one thing that really has changed is the development of technologies, these microstimulators, where we can place, pain is all driven by nerves, and if we can override those pain signals, then that can significantly reduce pain. So if you have back pain or leg pain or pelvic pain or knee pain, we can place, a little electrode right by the nerve, and then patients, just through a tiny skin nick, they get tested outside their body. And if this overrides their pain, if their pain goes down, we can permanently implant it. So that's what we're talking about next week at our community event at Beaumont, is just talking about a multidisciplinary approach with a focus on some of the new technologies that let us do that.
And how new is this? Is this in use?
I mean, what's interesting, it's in use, and I did my first one in 1997, so it isn't that the technology is new, it's the advances in the technology. It used to be very big, cumbersome limitations, and now it's a much smaller use. So I use it for pelvic pain. Mike, you use it for many other pains.
Yeah, and when you think about it, it's no different than your cell phone. I mean, the technology in terms of what you used to have for a cell phone.
Right.
In
the big bricks, and it's gotten smaller.
Exactly, and the amount of computing power in a cell phone, in the 60s, you'd have to fill the studio with that amount of computers to run that. Now these have gotten smaller, they're more effective. Some of the companies, the stimulation's on and you don't even feel it on, it's running at a very high frequency. Other companies have what's called adaptive stim, where it's programmed. If you're sitting, it runs at a certain level. If you're standing, it does it without you even having to adjust it.
So yeah, it's smart. It realizes what you're doing and adjusts itself based on your activity.
Exactly.
That is incredible. And what's been the feedback from patients?
So this in our hands when we test this, and it's the right patient. We don't put this in everybody, right? You go through a process of trying to manage their symptoms, but about 90% of patients will see, because we test it outside the body, and about 90% will see a significant reduction in pain. We consider that being at least a 50% reduction. If that works, then we'll implant it permanently. But in our hands, for the pelvic pain, it's that. I think you have similar.
Yeah, the data especially for low back, having looked through the last 3 years, I've seen somewhere between 75 and 80% relief for people who have an effective trial. As Dr. Peters said, the important portion is we do a 1 to 2 week trial that is just through a needle placement to see if it'll work for you. It's a test drive. So
you guys do have a community event. We want to put that information up on the screen so people can go find out more information about this. Where is it? And very quick, there it is. It is Tuesday, April 30th, 6 to 8. It's at Beaumont, and you can go to classes.beaumont.org to register, and we'll have that on our website to get people there, because obviously pain management is a big deal.